Well, welcome to this video, and today we're looking at mental health effects of this pandemic. And what we'll see is there's two groups of effects. Firstly, there's the stress and disruption and anxiety and worry and economic impacts and all the psychological effects they have of the upheaval caused by this pandemic. And the second group of effects are those that are caused directly as a result of the viral infection itself and the body and the mind's response to the viral infection itself. So the first group of problems refers to or affects everyone really, because everyone's involved in this pandemic. But the second group, the ones we're going to focus on today, are those which are suffered from as a result of the viral infection itself, rather than as a result of the chaos and the stress and the difficulty surrounding the pandemic. Now, we're going to focus on two studies today. One is from Italy. Now, the Italian study looked at hospitalized patients who were discharged and found that over half of them suffered from some form of psychiatric mental distress or ill health after they'd recovered from the acute infection. And the second study comes from Spain. Now, the Spanish study looked at a much larger number of people, but this was people that were infected in the community. So the Italian study was looking at people that had suffered severe COVID-19, sufficiently severe to be hospitalized, whereas the Spanish data looks at people who were in the community, many of whom had very mild disease. So interesting things to turn up there. Just to give you the bottom line on this video, both of these groups of patients got things like anxiety, depression, some post-traumatic stress problems. But the Italian ones who had the more severe disease got more severe symptoms. But having said that, the Spanish ones who had the milder form of the community-based disease still had significant numbers of mental health sequelae. So both are a problem, but it looks like the more severe disease are going to be more severely affected. But that doesn't mean to say there won't be some people who had mild disease who can be quite severely affected as individuals. And we'll look at the figures as we go through. So let's start off with the data from, actually just before, I'll say something else before I say that. You know, health is one of these things that when you've got it, you take it for granted. You just don't think about it. And it's probably never more so than with mental health. If you have good mental health, then to be mentally suffering is somewhat incomprehensible to you. I mean, personally, I had an anxiety period, and you'd say to people you're anxious, and they'd say, well, what are you anxious about? You know, a lot of people simply don't get it. They really don't understand this concept of mental illness. Now, of course, many of us do, because many of us have had periods of mental difficulties. It's no secret. I mean, most people do, of course, at some point in their life. Not many people have a clean run without mental problems at some point or other in their lives. But it's very hard for people to conceptualize it. And this is why psychiatry is still somewhat of a Cinderella subject, because many people really don't get it. But I've known many people who've had really good mental health, very confident people, very capable people, sometimes very highly achieving people, not necessarily, but sometimes. And then sometimes just over a period of hours, days or weeks, their confidence and their ability to do things just crashes. And they become completely incapable of doing things that they could do without batting an eyelid before. You know, the simplest of task appears like an Everest to be climbed, and it is an insurmountable summit. And then after the period of ill health has passed, these things can be simple and easy again. So everyone knows people like this, even if you haven't suffered from it yourself. So it is taken for granted very often, but helping to understand this means that we don't take it for granted. Now, this is the Italian study first of all, and the Italian study is called Higher Rates of Mental Ill Health After COVID-19. And do read this for yourself. Now, this is based on patients. This is the people who've had more severe illness from the San Raffaele Hospital in Milan. So, a big hospital in Milan. And more than half of the people that had recovered from this more severe form of the illness suffered from one of these: post-traumatic stress disorder with anxiety, insomnia, and depression. Some patients had the post-traumatic stress disorder features, others had the anxiety, others had the insomnia, others had the depression to a greater degree, but sometimes they were mixed up as well. So all of these things came from it. So anxiety is this disproportionate reaction to outside stimuli, that you feel anxious about things that you normally would not feel anxious about, or you feel anxious and you don't know why you feel anxious. And of course, if you don't sleep, that becomes a vicious circle. And in depression, another word for depression is hopelessness. For someone who is depressed, you have to understand there is no hope for that person. The situation is hopeless. Now, other people can be helped, but the individual with depression can't be helped, or so they think. That's what they feel. Of course, let's stress, nothing could be further from the truth. The person with depression is eminently helpable. There's so many things we can do, and depression can often resolve completely. But at the time, that person believes that for them it's hopeless. That's a good way to think about depression. There is no hope. Their situation, their difficulties aren't like anyone else's. They're so much worse and they can't be helped. But actually, you and me, who have soundness of mind at this present time, realise that they can most definitely be helped. But that's what depression is, that awful feeling of hopelessness, and other features as well. But I think that's the main thing to realise about it. This is why often people with depression don't seek help, because they believe they can't be helped. Now, interestingly, the severity of the psychiatric features described in the Italian study were in proportion to the severity of the inflammatory changes during the disease. In other words, the sicker the person was with COVID-19, the more severe they suffered from PTSD, anxiety, insomnia, or depression. So they found it was related to the severity of illness. Now, the study wasn't huge, but it was 393 people altogether in the study. And they were following up at 1 month after hospital treatment, based on clinical interviews and self-assessment questionnaires. So fairly standard ways to gain histories and gain information about someone's state of mind. Now, they found features of post-traumatic stress disorder in 28% of the people that had the condition. So that's pretty high. Depression was the predominant feature in 31% of people. So just think what this means globally. This means of people that get COVID-19 disease, where they have a severe episode of the disease, this 5 or 10% that get quite ill and need hospitalised, where they have inflammation, we can expect half of them to suffer from psychiatric sequelae. 31% of them could have significant depressive features. This is a lot of people that are going to need help over the next months, and indeed potentially year or two. Because this data was collected in a month, what we don't know yet is what this will be like in 6 months or a year's time. Now, I'm hopeful that many of these will resolve, but we don't really know that at that stage. What I know about anxiety and depression already mean to me that these conditions can resolve. What I know about insomnia means that these conditions can resolve. But we don't actually know. We don't have the data yet because it's not yet 2021 or 2022. We simply don't know yet. Anxiety, 42%. Insomnia, 40%. And this was interesting. People developed obsessive compulsive symptoms. 20% of patients developed obsessive compulsive symptoms. Now, I think most of us have probably had this at one time or another. In obsessive compulsive disorder, you have a feeling that you want to do something. Then you try and resist that feeling, and then you end up doing it. So obsessive compulsive disorders can be anything. So people can obsessionally wash their hands, that they can obsessionally tidy up, or it may be actions that they carry out that can look quite bizarre, constantly taking their shirt on and off, or adjusting their tie, or compulsively doing any number of things. And this can sound a bit funny, and it can look a bit bizarre when you see people just and sometimes it's just as simple as touching things. You just had a desire to touch that there. Oops. It's, just sometimes it can be things as simple as that, and it can look quite bizarre, but to the individual it's distressing because they know they're doing it. They have perfect insight, but they can't stop themselves doing it. This OCD, obsessive compulsive disorder. So I was surprised that one came up, but if that's what the data shows, that's what the data shows. Now, moving on to the Spanish study. This is called Mental Health Consequences During the Initial Stages of the 2020 Coronavirus Pandemic, COVID-19 in Spain. And this is published in a reputable journal, Brain, Behaviours and Immunity. So a well-recognised journal. Read it for yourself. Full text is there. Now, this was an online survey of 3,480 people, so this is a good sample size. And this one was from the general population. So this was not people that had been hospitalized. So in other words, this was people that had had a milder form of COVID-19 and had recovered from the symptoms of COVID-19. But they still suffered from depression, anxiety, and post-traumatic stress disorder features. They were still there. So this collected data on the mental state of the people, and it also collected data on, remember, of course, we're dealing with Spain here, which is quite a very Catholic country, quite a lot of religious belief in Spain. So they collected data in addition on additional spiritual well-being, loneliness, social support, discrimination and sense of belonging. And of course, these are all well recognised in psychiatry. So we know that spiritual well-being is a very good prognosticator for mental illness. We know that loneliness is a very bad prognosticator for mental illness. We know that social support is massively helpful in mental illness. And we know that discrimination is bad. And we know that a sense of belonging and inclusion is good. So these things are all well recognised already, but it was good that they collected data on this, and there is an awful lot of data in this study. But while the numbers were less than those with severe disease, so with severe disease, how many got depression? It was how many got depression with severe disease? It was 31% got depression with severe disease. Here it was 18.7%. So still quite a lot of people getting depressive features. With the severe disease, the anxiety was 42%. With the milder disease, the anxiety was 21%. So, and the PTSD in the severe disease was 28%, whereas here it was 15%. So what we're seeing is people with milder disease get less frequent mental manifestations as sequelae of the COVID-19, but these are still significant numbers, even with people with mild disease. So this is, given the number of people that have had the infection, we can expect to see greatly increased incidence of depression, anxiety and post-traumatic stress disorder for a period of time. We don't know how long. Now, this study was good in the Spanish study because it demonstrated positive things. So spiritual well-being was positive. Social support was positive. Older age group did better as well. That was somewhat surprising. Economic stability helped. And this is an interesting one. Belief that adequate information had been provided. So giving patients adequate information is absolutely critical. Yes, you've had this infection. No, I'm not too surprised you've become depressed. Giving them the information about that. At the moment, we can't be as reassuring as we'd like to be because we simply don't know. But what I would say to these patients is, look, I've had many patients before with anxiety and depression, and the vast majority of them make a really good recovery. I myself have had anxiety and depression, and now I feel fine. You can make a complete full recovery and return to normal duties, to a normal frame of mind. And I am remarkably hopeful that the same will be the case for you. We can be guardedly positive, even though we don't know specifically how it's going to pan out because of the particular etiological or causative factor that was the COVID-19, or the trigger factor that was the COVID-19. Again, these things aren't really clear yet. The negatives: loneliness was bad. Women did worse than men. That was a bit surprising. But nevertheless, that's what the data shows. Previous diagnosis of mental health problems or neurological disorders was also a bad prognosis, meant things were probably not going to turn out quite as well. Ongoing viral symptoms made it worse, because some people can get prolonged symptoms, as we know, and close relatives with infections also made it worse. So just to conclude that section, I'm afraid we can expect to see more psychiatric problems, more mental distress. And I think what we've learned from this is someone with mental distress does so much better in a supported environment if they're supported with someone like you to support those around you going through mental distress. And this is going to be absolutely vital. I think it's fair to say that everyone watching this video over the next months and year will have a role in supporting someone who is struggling for a period of time. And our role is to come alongside them and be with them, to metaphorically or indeed literally hold their hand while they're having this period of difficulty. Now, I think I'll just do briefly, we've looked at sequelae in previous videos related to the heart and the lungs, but there's also evidence emerging of sequelae affecting the nervous system. Now, neurological disorders, of course, are not the same as psychiatric disorders. Neurology is a branch of, psychiatry is a branch of medicine, but neurology means disease of the nervous system, whereas psychiatry is the study of abnormal behaviour. It's a different thing. But briefly, we'll look at some neurological complications. Trouble with neurology is everything, has a big word attached to it, but we'll see if we can cope with a few of them. So this paper is called The Emergent Spectrum of COVID-19 Neurology. Clinical, radiological and laboratory findings. So they found this out through clinical examinations, X-rays like MRI scans and CT scans, and laboratory findings. Do read it for yourself. They admit it's preliminary. Now, what they do state definitively is severe acute respiratory syndrome, coronavirus, SARS, coronavirus 2 infection is associated with neurological and neuropsychiatric illness. So this link, they are saying, is established. So far, it's looking like the number of people suffering from psychiatric disorders is relatively high, but the number of people suffering from neurological disorders of the nervous system, is much lower as a sequelae. It certainly seems to be lower than those suffering lung problems or heart problems, but it still could be significant. Now, this paper doesn't give whole numbers. It's not that kind of paper. It's looking at the spectrum of things that are emerging, but it looks like it's less prevalent than things affecting other systems, but more information may emerge over the next month. So been monitoring patients since March 2020, taking detailed clinical and paraclinical data. So that means how old you are, where you live, what job you do, all the information about you that's not directly related to the clinical condition. People were all diagnosed through ribonucleic acid polymerase chain reaction, or diagnosed using World Health Organization criteria where testing wasn't available. Now, what did they find? Well, they found 43 patients were referred to the neurological unit in London where this was based. Now, they found some patients with encephalopathies, delirium and psychosis. Now, N means in, Ceph means brain, and pathies is disease of. So what this means is there was infections causing inflammation in the brain or immunological reactions to infections causing inflammation in the brain. One or two people had fits as well, actually. But 70% of these seem to be making a good recovery. So inflammation of the brain in the brain caused by the virus or the immunological effects of the virus. Other inflammatory central nervous system syndromes. A syndrome is a group of clinical features. Again, these were immune related, some autoimmune related, the way that the body. So the body was trying to react against the virus, but it managed to react against parts of the nervous system as well. And these mostly had abnormal muscle movement effects, affecting the muscles, because of course it's the nervous system that controls the muscles. Now, as we know, there was some ischemic strokes. Now, ischemic means not enough blood supply to the brain in this case, because of the pro-thrombotic state. That means the blood is more likely to clot. Now, this affected large vessels and small blood vessels, and often affected younger people as well. The numbers weren't great, but it did involve large and small vessels, meaning the potential for a permanent stroke certainly there. Now, Guillame-barres syndrome is a well-known post-viral problem. What happens in Guillame-barres syndrome? We see quite a bit of this. Basically, all the peripheral nerves become inflamed and don't work for a period of time, and the person has a temporary paralysis. Sometimes it can affect the phrenic nerves and the intercostal nerves, so the person can't breathe for a period of time and they need to be ventilated. Normally, about 95% of these patients we would expect to make a full recovery. So Guillame-barres syndrome is this temporary disorder, and this one's caused by the peripheral nerves, the nerves that aren't in the spinal cord and brain. And most of them resolve, but the inflammation means they don't work for a period of time. And then the other condition they describe were acute disseminated encephalomyelitis. Now that means it comes on all of a sudden. Disseminated means it's in different parts of the central nervous system. Ceph means it's in the brain. Myelitis means inflammation of the nervous system, of spinal cord, sorry. So this is inflammation of the brain and the spinal cord is what this means. Sometimes it's called A, D, E, it must be M, Adam, yeah. And the patients can get quite ill in the acute phases of this. And so far it's looking like most patients are recovering well from this. Sometimes they're given steroids to reduce the inflammation, and most of them seem to recover. But of course, there's always some with residual damage. Now, the problem with nervous system disorders is if the nervous system is actually damaged, it won't recover. But perhaps with the exception of the strokes in these conditions we've looked at, it looks like these patients are having an inflammatory episode, and most seem to be recovering. But again, it's on a relatively small sample size. It's only 43 patients. So I think the bottom line here is, can we expect to see sequelae affecting the lungs? Pulmonary fibrosis, yes, quite a lot. Can we expect to see problems affecting the heart? Sequelae, reasonable amount, yes. Could both of those conditions be potentially permanent? Yes, they could. In terms of the nervous system, in terms of psychiatric mental disorders, we're going to see a lot, as we've spent the most time on this video talking about. In terms of neurological disorders, we will be seeing more, but hopefully this is not going to be such a big problem. And we're hopeful that most of the neurological disorders are going to resolve. There will be some that probably don't. But the thing is, with these neurological disorders, they actually take quite a lot of management to get the patient over it. So all of these have significant implications for increased healthcare demand over the next year or two, even after the acute episode of this pandemic has resolved. And again, countries with poorer healthcare and less availability of healthcare, again, people living in those countries are going to suffer more than people living in countries with affordable, available healthcare systems. Okay, I think we'll leave that one there for now. But just bear in mind, you will be needing to support people with difficulties in mental distress. I think we all do that anyway, but there could be more of it over the next year or two. So that's going to be a job for everyone.